Thank you, Mr Acting Deputy President. I rise this morning to voice my opposition to the Restoring Territory Rights Bill. While this bill is couched in terms of the restoration of rights to the territories, what it really is, in truth, is a new voluntary assisted dying bill. And this debate is one that is, of course, emotionally charged. For those who oppose this concept of voluntary assisted dying, and for those who wish to see this in the light that it really should be, and for those that are concerned about the suffering of those who are in terminal pain, we hear all of those arguments. I hear all of those arguments. But you don't have to be necessarily a religious person to oppose euthanasia. You just need to understand the facts. And I think it is helpful to understand where this leads. Far from being different or indifferent to the suffering of others, opponents of euthanasia oppose it for a variety of ethical reasons, as well as because of the deteriorative impact of euthanasia on our society. And despite the mangling of words that we see, it has to be looked upon as a form of suicide. And whether we're discussing whether euthanasia should be legal, we're discussing whether suicide, or more specifically whether a medical professional can assist someone with that suicide and whether that should be legal. And one of the fundamental tenets of any society is that we respect human life, and that this can't be the answer to suffering, whether it be mental, physical or both. And that's why the federal governments of both colours and persuasions have spent $11 billion on funding mental health services over the years. So to support this on the one hand and advocate for suicide prevention on the other, to me, seems entirely hypocritical. It's surely, in either case, a terrible outcome for individuals and for society, and particularly when we want to prevent this in either occasion to the best that we can, because we want to affirm life, whatever the circumstances are. But the underlying ethos has to be reminded, and that is that some lives just aren't any longer worth living. And if we in this place send that message, then ultimately it devalues the lives of citizens rather than cultivating a sense of meaning and morality. Now, practically speaking, the message that this is a way out leads to an increase in the demand. That's just a fact. And to quote a recent peer-reviewed study conducted by the Anscombe Bioethics Centre in Oxford, England, quote, introducing euthanasia, is followed by considerable increases in suicide, inclusive of assisted suicide. There's no reduction in non-assisted suicide relative to the most similar neighbour where euthanasia isn't practiced, and in some cases there's a relative and or absolute increase in non-assisted suicide. Another peer-reviewed study for the Southern Medical Journal by the same author focused specifically on the United States, and it concluded that legalising euthanasia, has been associated with an increased rate of total suicides relevant to the other states and no decrease in non-assisted suicides. This at least needs to give us cause to pause before going down a road that will certainly legalise the so-called right to die. And proponents will often mock those who are opponents for making this slippery slope argument, even though the slippery slope quickly becomes evident each single time, as it has in international jurisdictions where euthanasia is legal, and in, of course, closer to home in Victoria, where it's only been legal since 2019, and sadly 175 people were euthanased in Victoria by the end of 2021, which was an enormous increase from the 49 deaths the previous year. So the data supports the conclusion that euthanasia is related to an increase in these assisted suicides, whether they're suicides in general, whether they're assisted or not. So I ask the question, is this what the public really wants? Laws that have an instructive effect on the morality of society, that is part of their purpose to uphold and enforce morality. It makes sense that those rates would increase when any government or any legislative body signals that this is the way to proceed. The Commonwealth power used to ban euthanasia in the territories, in my view, was a good and just use of the Commonwealth authority, as it protected vulnerable Australians, the sick, the elderly, the mentally ill, by preventing the territories from legalising voluntary assisted suicide. And this restriction should, in my view, remain in place If we do, in fact, care about reducing the number of suicides in Australia, the demonstrable proof is there. As I said, the slippery slope effect is very, very real. And we've seen this in the Netherlands, where children as young as 12 now can access these services. And more Dutch citizens are opting for euthanasia due to psychological disorders such as depression. These are just facts. Again, is this something that the people of the territories really want, people of Australia really want? Is that a picture of a flourishing society, or more indicative of one that is going down the wrong path? Part of the problem is that euthanasia legislation is predicated on the concept of suffering, which we all understand and we all sympathise with, and that's difficult to define. So being open to it being interpreted liberally by others is always a problem in these legislative dilemmas. To quote an associate professor on the board of Palliative Care Australia, "I'm concerned that we are too caught up with our right to die while not investing in a system that helps us live as well as we can before we die. And more Australians die in pain because of the lack of access to palliative care, not because of palliative care. And good quality palliative care obviously can't work for everyone, we accept that, just as heart surgery can't work for 100% of people. But for the majority, palliative care is an experience that is essential in those circumstances, those terrible circumstances. And we've all been through those, I should say. Mr. Acting Deputy President, having the option of voluntary assisted suicide means that people who would not otherwise consider it also do feel the pressure to do so, fearing that they'd be a burden on their loved ones rather than simply being able to expect that they would be cared for as is their right. There are terrible and very real stories of elderly people being neglected by family members so they will choose suicide sooner. The left of politics may dismiss these stories, but they do happen, and they are terribly tragic, like many of these stories are. I want to conclude my remarks shortly about this bill and say finally that one can't address the topic without noting the way in which euthanasia fundamentally changes the doctor-patient relationship. And there was the ancient Greek Hippocratic Oath, which is still a document, or up until recently was still a document fundamental to the importance of Western practice of medicine, reads, quote, "I will do no harm or injustice to patients, neither will I administer a poison to anyone when asked to do so, nor will I suggest such a course. Into whoever's house I enter, I will enter to help the sick, and I will abstain from all intentional wrongdoing and harm." We would like to think that as a society we are more enlightened than the ancient Greeks regarding medical ethics. The dignity of the sick and the suffering and our obligation to help and comfort them has to be our paramount concern. That cannot be forgotten. I think the answer to the question is clear, and it's for these reasons that I oppose the bill.
Senator Brown.